Welcome to Health Professional Radio. I'm Henry Acosta, the host for this episode. Today we have Lesley Brydon, CEO of Painaustralia. Painaustralia is a not-for-profit organization established to improve the treatment and management of pain in Australia. They were established back in early 2011 with the goals of helping people in pain and making it a national health priority, spread knowledge and awareness about pain, and train professionals to help people deal with pain, and also improve quality and research all around this subject matter. Today we're here to talk about Painaustralia and what's coming next for them. Hi Lesley, and pleasure to have you on studio.
Good morning, Henry. Thank you. It's a pleasure to be here.
Can you tell us a little bit more about yourself and what you do?
Yes, I do what I do because I am someone who lives with chronic pain. Indeed, I trained originally as a pharmacist and subsequently studied journalism and have worked in healthcare communications for a large part of my life. But at the age of 65, I had developed very severe arthritis, and at the time I was running the advertising Federation of Australia and was forced to retire really because of the pain. I subsequently met Professor Michael Cousins, who is one of the world's leading pain experts, and I learned that there was a great deal of new knowledge now about pain, in particular chronic pain, and the complexity of it, the role of the mind, the role of the nervous system, and how chronic pain does become, in fact, a disease in its own right. And so since that time, back in 2008, I have worked with Professor Cousins and around 150 other healthcare and developed what became the world's first national pain strategy. And held the world's first National Pain Summit at Parliament House in 2010. I think that's been a real watershed in terms of understanding and improving treatment of pain. Professor Cousins was subsequently invited to lead an international pain summit, which was held in Montreal in 2010, where we got agreement on a set of principles and guidelines for establishing pain programs in any country, anywhere, and also agreement on a human rights declaration that access to pain management should be a fundamental human right. It's known as the Declaration of Montreal. And it is now supported by the World Medical Association and human rights organisations worldwide.
And what inspired you to becoming one of the leaders in this industry?
Well, I think I've got the trifecta, Henry. I mean, I've got the chronic pain. I'm trained as a pharmacist, so I, in fact, understand the medical environment and healthcare principles generally. And I've worked in communications and advocacy. So bringing all of those skills or experiences together, I think has enabled me to do the work I do. I really feel that at this stage of my life, I'm about 75 now, and I really feel that perhaps for the first time I'm doing something that is of real value and is going to leave a legacy in terms of improving healthcare for people like myself, but I should say people much, much worse. I mean, we see people every day who live with the most desperate chronic pain, and it really is a very neglected area of healthcare. We need far more research. We need much better education and training of healthcare professionals to help people with chronic pain, and we need much more, a much higher level of health literacy and understanding amongst consumers so that they can actually self-manage their own condition, because like all chronic conditions, chronic pain really does need the patient themselves to take control and to manage the condition with the support that they get from well-trained medical professionals, medical and healthcare professionals.
And with pain not really being well known as a topic of interest in the medical industry, even though it's one of the early symptoms of chronic diseases, why do you think that's the case about it?
Well, I think that one of the real problems when we started this process back in 2010 with the National Pain Strategy, pain was nowhere in healthcare policy. It was not recognised, and chronic pain was not recognised as a condition in its own right. It was always seen and even dismissed as simply a symptom of some other problem, of arthritis, of cancer, of multiple sclerosis, or some other disease. And it was never really taken seriously by the medical profession. And I think much of that has changed now. I think that the work that has been done by researchers to understand the complexity of pain, the fact that it is not just a physical condition, that it is chronic pain particularly is influenced by psychological and environmental or social factors. I mean, lifestyle factors are hugely important, but also somebody's personal environment, whether it's at work or whether it's at home, or whether it's the community they live in. People's mental state and outlook will influence the experience of pain, as does the meaning of the pain, perhaps the causes of the pain, the original trauma. I mean, we see that particularly, say, in young soldiers coming back with horrific injuries, and where post-traumatic stress is a major factor. But almost in every case, chronic pain is a factor alongside the post-traumatic stress. And the two conditions live side by side. When the stress is experienced, then the pain kicks in. And when the pain is there, the trauma and the stress is relived. So that people in everyday life experience that too. If the pain has a very nasty and horrific meaning, then often it will be worse. But learning to understand that, people with chronic pain can actually do a great deal themselves. We find that we run consumer groups and, having a basic education about the science of pain, what is actually going on in their bodies, can make a real difference to how people experience pain and how they manage it, often through things like meditation and relaxation and exercise and, therapies that they can activate themselves without taking pills. I mean, the last thing people need to do with chronic pain is to be taking medication. We don't have any decent medication for chronic pain, let's face it. I mean, opioids, the safety profile of opioids rules them out, basically. Except for very extreme cases where they can be helpful to people. Opioids are not helpful. We do need better medication, there's no doubt about that, so we need better research, but we also need to embrace the alternative therapies.
What are the other suggested alternative therapies that you can suggest? And also, what are the best ways we can manage pain?
Right. Well, I mentioned some of them just then. A self-management program. These programs, by the way, are being taught in pain programs. Originally, they started in public hospitals, but were very limited and had long waiting times. We are now developing pain programs in primary care, where people can go in a group, a small group, and learn techniques like meditation. That can embrace particular desensitization techniques like pacing, so that you don't actually overdo physical activity or any other activity that might aggravate your pain. Exercise, but not just any exercise. I mean, exercises need to be tailored to the individual. And, a good, well-trained physiotherapist or occupational therapist or other physical therapist can help with that. We do know, for example, that people who are involved in active exercise strategies and meditation do much better in managing their pain than people who rely on passive strategies like massage, for example. I mean, massage can be extremely helpful if you've got various forms of pain, particularly musculoskeletal issues. But they're not, on their own, they're not going to help anybody. You really do have to take control of your pain. I mean, things like hydrotherapy are enormously helpful to people with chronic pain conditions. Not just, arthritis, but also autoimmune diseases. There's all sorts of mystery diseases now that seem to cause chronic pain and complex regional pain syndrome. And hydrotherapy and self-management programs can be very helpful for that. But I have to say, Henry, the biggest problem about this is the complete lack of support of the Medicare system and the private health system for alternative therapies. The Medicare system perpetuates an acute care model. It simply does not provide adequate support for people who want to self-manage their pain, who want to learn more, and want to take responsibility. I mean, I can tell you that personally, my out-of-pocket healthcare expenses in the last financial year were almost $20,000. And a lot of that, I mean, that's even though I do a lot myself, but I still go to the physio, I have regular exercises. I did have to have major surgery. I've had to have 5 joint replacements so far, and possibly others to come, if there are any left to come. But the reality is that our system does not support a preventative approach, and nor does it support people in their active self-management programs. And one of Painaustralia's major goals is to change that.
What's the biggest misconception that you usually face around your organization?
Well, I think, lack of awareness of pain generally. I think the stigma associated with pain. I mean, years ago, it was much worse, I must say. It was a bit like depression. 40 years ago, people were quite dismissive of people with depression. We now realise that it's actually a biological condition or a serious medical condition that needs proper help. And so too is chronic pain. So that the ongoing stigma, the frequent discrimination against patients by their medical professionals, by people who, I understand that it's very frustrating for GPs and other health professionals that they can't help people with chronic pain. But that's not to say it should be dismissed, and it's not to say that it's all in their heads, and it's not to say that they're bunging it on. If they say they're in pain, people are in pain and they do need appropriate help. But it's not necessarily medical help. It might be psychological support. So one of my great challenges, I guess, is chronic pain is real, that it destroys people's lives, it must be taken seriously, and that there are ways now to learn about it. We have excellent online education and training programs for medical professionals. We've got wonderful resources for consumers available on our website. Painaustralia's website we not only have our own resources there, but we're a gateway to a whole host of other really good videos and fact sheets and reading matter and advice that people can actually benefit from. The biggest frustration is making people aware of it. Painaustralia is a completely unfunded body. We get absolutely no support whatsoever from government. I have to do all the fundraising. And frankly, it's a battle. And it shouldn't be, because chronic pain is the biggest cause, the biggest burden of disease worldwide. Back pain and arthritis are the primary cause for people of working age to drop out of the workforce, and I'm an example of that. And therefore, it doesn't make any sense whatsoever that it continues to be ignored and underfunded and in the way that it is.
And what's next for Painaustralia as an organization?
Yes, well, I think next year holds some promise, Henry. We have an opportunity now. We've been advocating for pain management to be considered within the current Medicare review. And the government now has agreed the MBS task force will review pain management in its own right, not just as part of something else, in its own right. And it will obviously look at current Medicare items, which are largely related to procedures for chronic pain, which are only necessary for people in extreme circumstances. But we have an undertaking that they will actually look at new item numbers to support a chronic disease care plan with extended GP and allied health consultations, and also potentially a pain program, which will enable people to learn about their pain and learn basic self-management techniques. If we can do that, I reckon I can retire, Henry. Let's face it, there'll still be a lot to do, but that will be a major, I think, achievement if we can do that this year.
And for our last question, for anyone who wants to support Painaustralia, how can they reach you and maybe talk to your organization?
Painaustralia.org.au is our website. So if they come to the website, they can access all of our resources. They can actually make a donation, or if they wish, I can't give you a landline, I'm afraid, to call because we're just about to move offices. We rely on the generosity of pro bono service providers, so we're having to move from one office to another. But best they go to the website, or they can send me an email, Lesley, Lesley, .Brydon, Brydon, @painaustralia.org.au.
Awesome. Well, that's all for our questions for today, and thank you for being on the show, Lesley. It was a pleasure.
Thank you very much, Henry.
And that was Lesley Brydon, CEO of Painaustralia. Painaustralia is a not-for-profit body established to improve the treatment and management of pain in Australia. Me and Lesley just finished talking about what's next for Painaustralia and hope to spread awareness and some knowledge on the current issue. I'm Henry Acosta, and you've been listening to Health Professional Radio. You can visit us on www.healthprofessionalradio.com.au or on hpr.fm. You can also find us on SoundCloud and iTunes.